Question number 7, Simon O'Connor.
Thank you, Mr. Speaker. What progress, this is to the Minister of Health as well, what progress has been made towards achieving the government's national health targets?
The Honourable Dr
Mr.
Jonathan
Speaker.
Coleman.
This week, the Ministry of Health published the health target results for Q3 2015-16. They show good progress overall, with the elective surgery target again being achieved with 146,000 elective surgical discharges provided for the year to date. That's nearly 8,000 more than were planned. We've delivered around 50,000 more surgeries over the last 7 years. The target for heart and diabetes checks was met for the third consecutive quarter. Around 1.2 million people have had their cardiovascular disease risk assessed in the past 5 years.
Question.
Order. To the Honourable Annette King, you've interjected on every question. We're now on question number 7. If you interject again, I will deal with it severely. Supplementary question, the Honourable Simon O'Connor.
Thank you, Mr. Speaker. What changes will be made to the national health targets?
The Honourable Dr Jonathan
From the
Coleman.
1st of July, a new childhood obesity health target will replace the heart and diabetes checks target. By December 2017, we want to see 95% of children who are identified as obese in the before-school check referred to an appropriate health professional for clinical assessment and intervention. Heart and diabetes checks will still remain an accountability measure for DHBs to ensure the gains made are not lost.
Supplementary question, Simon O'Connor.
To the Minister, what reports has he seen on the numbers of doctors and nurses in our hospitals who are helping meet these targets?
The Honourable Dr Jonathan
Mr. Speaker,
Coleman.
our dedicated health workforce has been crucial in meeting these health targets, and we now have a record number of doctors and nurses working in district health boards across New Zealand. At the end of March this year, there were over 7,880 doctors and 22,500 nurses employed by district health boards. That's almost 2,000 more doctors and nearly 4,200 more nurses compared to 2008.
Question number 8, Ateria Ture.
Tēnā koe, Mr. Speaker.